Welcome everyone to this webinar, which is actually a follow-up of an amazing session that we had during the IMCAS Congress in Paris a couple of weeks ago, actually 2 weeks ago. And the topic of that webinar, of that session, was actually masculinity and masculinization with minimally invasive treatments with soft tissue fillers. And the feedback was so great that we said, well, we need to repeat this and we need to do another webinar. And this webinar happens today on February 15, which is a very nice date because actually yesterday was Valentine's Day. And today we're talking not only about the females, now we're talking also about the males, because as most of you have heard during the last session when we said during IMCAS, is also male have aesthetic needs. So I'm really looking forward to this one. And the official topic is mastering masculinity, a deeper dive into Genefill's guide to full masculinization, how to select the patient properly and how to treat according to their respected guidelines. However, during this webinar, I won't be alone because I have two amazing physicians who will join me for this one. And one you can see on this side here, which is Dr. Nazaret Ruiz Lopez. She is going to be with us as well. And she's going to talk about the facial masculinization, the facial procedures. And on this side, no, here, over there we have Dr. Miguel Bravo, who will talk about the masculinization of the other face of a little bit more downstairs, which is the gluteal area. So we're going to cover these respective areas today, which means the face and the other face, specifically focusing on male aesthetics. A couple of housekeeping rules. The duration of the webinar is set to be for 60 minutes. And we're going to have 3 presentations. I'm going to go first, and then we're going to have Nazaret, and then we're going to have Miguel. Each of us are going to talk for 15 to 20 minutes. And then at the end, we're going to have an open question and answer session. So it means if you have any questions along the way, please post them into the Q&A segment. You see on your Zoom down there, there's a Q&A button. You can post your answers there. We will filter your questions, and at the end, we will answer some of those questions. In case you might want to post those questions in the chat, you can do it as well, but it's easier to monitor the Q&A than it is the chat box. So actually, I would like to ask quickly Nazareth and Miguel to say just hi to the audience before I will start with my presentation. Nazareth, where are you based now? And what time is it for you? I think that's one of the most important questions that everybody wants to know.
Do you repeat me the question? I didn't understood you. I'm sorry.
No, where are you based right now? And what time is it for you now? Time zone.
For me, I'm in Spain now, and now it's, let me see, nearly 4:30.
4:30, wonderful.
Here
Miguel,
in Spain,
where are
in
you
the
based
north
and
of
what time?
Spain, where it's rainy and very, very hot today.
Miguel, where are you based now and what time is it for you?
So I am in Abu Dhabi, and I'm so it's now 7:36 here, and I'm just finishing in the OR, and now I'm here in the clinic, ready for the webinar. Looking forward to it.
Wonderful, that's great. So guys, for me, it's now 9:30 in the morning, because I'm based in the US and Central US time. So you can see from all over the world, we are here for providing you this amazing webinar on the topic mastering masculinity. And without further ado, I will go first. I will have my first presentation about gender dimorphism. And to do so, I will share my screen, which I'm going to do right now. And then we're going to start with this respective presentation, which is going to be here. So the topic of my presentation is going to be male, female, and binary, anatomical differences and similarities. I think these are all important aspects we need to consider because male and females, they have different anatomy. And because there is different anatomy, there are also different aesthetic needs. Because you can imagine some parts of the face are different between males and females. And during aesthetic procedures, you want to address those different needs, and you want to know about those needs, and you want to target and treat them accordingly. I think this is all very important to consider. I have nothing to disclose as I'm talking about the respective anatomy here, and one of the most and first important topics is embryology. I don't know why we always talk about embryology, but I think it's important to consider this aspect. And when you think about sex dimorphism in terms of when someone's determined by genetics to become male or female, interestingly enough, early on in the ancient times, there was a different theory how male and females are being formed and conceived. And everything had to do with the temperature. And it's interesting enough, for instance, when the heat of the male partner, actually that determines the sex. If the male's heat could overwhelm the female's coldness, then a male child would form. But on the other side, if in contrast the female coldness was too strong, then a female child would form. I mean, this is very old understandings, and I'm very happy that we switched away. But now these days, we also know that this is just not the case, because everything has to do with this one. And this is the chromosomes that we have. And here at the end, there is the small, tiny little one, which we call the Y chromosome. And on the Y chromosome, there is a region which is called sex-determining region Y, SRI gene. And this gene induces many, many things, But what is important to understand is if we would not have that gene, we would continue our pathway towards becoming a female. So it means everything is determined and the road is to female. If this gene is available, then many other things happen, and then we deviate into male. So maybe we can also consider that males are a deviation from the general plan that Mother Nature, also female, has for us. And then these are all the different aspects that you consider. Upon determination from the SRI gene, we have then the TDF, and then which have testosterone, and the very, very different effects of testosterone, which happens early on in the embryo to have a brain masculinization and the different internal and external genitalia, and of course, the respective features and growth factors that are released on the bones. But let's focus on body anatomy, and one of the most important features that we need to consider, because it applies to every region, not only of the face, but also to the gluteal region. Everything has to do something with the underlying soft tissue envelope. And one of the best examples how we can compare male and female is cellulite. It's one of the best examples that we have, because no one is safe from cellulite. Everybody at some point will have it. And we could think about, well, if this is true, yes, some males have it, but those males are very specific, because those males can look like this. And the reason giving is, while at some point males could also be affected by cellulite, is because of their BMI and the hormones that are being then produced by the adipose tissue, which we know have a lot of aromatase factors, which then induce also the superficial appearance of cellulite. However, we need to understand, how does this work? How does it work? And to doing so, we need to understand a very simple aspect. Under the skin, there is a highly organized structure of connective tissue and fat. They are together, connective tissue and fat. And the connective tissue itself is a strong system that connects to the underside of the dermis. For instance, you can see this here very nicely in this early publication in 2004. You can see in black connective tissue fibers, and those connective tissue fibers connect to the dermal undersurface. And this influences how it presents on a skin surface. And this is different between male and female. And what we knew from the clinical appearance is that predisposing factors for cellulite is sex, is gender. Female gender is one of the predisposing factors for cellulite. Of course, high age and high BMI are also contributing factors, and skin laxity. But if you understand this, if you want to break it down to a better understanding, is we can generally, overarchingly say females will develop cellulite, whereas males don't. And this is a very important aspect to consider when you do research studies. For instance, like this one. This is one of the studies that we did a couple of years ago in 2019. I think it was a very interesting study. And I will tell you what we did in the study to investigate certain aspects. For instance, you can look at this area here. When you do a cross-section through the gluteal area, you can see different layers. You can see skin, superficial fascia, deep fat, gluteus maximus, and a deep fascia. You can see all of those aspects here, the 5 layers that are visible in the gluteal area, which later on Miguel will also address in his presentation. But if you remove the fat, you can just see the connective tissue, that system that connects to the dermis, which is located here on the top. And this is a view of females, and this is a view in males. And you can see there's a big difference. There's a significant difference in the size, in the thickness, and in the orientation, all of these septae. And in what we did in a study, we conducted a lot of measurements. For instance, you can see here that the skin thinness or skin thickness is influenced by age. The older we become, the thinner the skin is, but there's not a big difference between male and female, at least in a sample that we investigated. But what we found out is when you count the number of honeycombs, which are located in a subdermal area, if you count those numbers, you will find out that there's a difference. Males have more honeycombs. On the other side, what it also means that males, because they have more honeycombs, more fat lobules in that respective area, they have more stabilizing pillars. They have more pillars per area. I think, and this is really important to understand, they have more pillars per area. And if they have more pillars per area, we could assume that there is more stability in males than in females. And we tested this in the study. Because what we did mechanical testing, stress to failure testing, and we looked at males versus females, and we just pulled and saw how much force was needed to rupture exactly those specific regions. You can see this here, and we measured the force. And then when you look at the differences between male and females, you can easily see that there's a statistically significant difference with females requiring less force than males. It makes sense from an anatomical perspective because males have more connective tissue per area, whereas females have less. And connective tissue allows for stability. So that means females have less stability, whereas males have more stability. And this is what this study shown. And interestingly enough, this is applicable for the entire human body. Not only for the gluteal region, because it's a nice model to investigate when you look at cellulite, but it's also applicable for the face, for any other facial region. Males have more connective tissue in their subcutaneous arrangement. But there are also other differences between males and females. You know, especially in the face, it's important to understand that muscles are also connected with connective tissue. And this is one of the studies that we did with electromyography. And we looked actually the differences between male and females, and we did find statistically significant difference in the muscle mass and in the strength of the muscles and in the signal that these muscles produce, which can be seen not only in the zygomaticus major muscle, but also in many other muscles of the face, because males have more muscle mass than females. And muscle mass, especially in the face, allows for more stability, which in relationship kind of also induces laxity and specific features. And we also looked into the forehead, for instance, and here in the forehead, you can also see kind of like independent of which muscles you're looking at, males always had significantly more strength when it comes to females. But now when you look at the muscles of mastication, which is a different type of muscle, because muscles of mastication, they are skeletal muscles. They're not facial muscles. They're both striated, but they are different in shape and orientation. And we did this study, and what was very interestingly is we looked at the volume of the temple, because in the temple, we have muscle that majorly determines the difference between male and females. And what we found out is along the way was that as we age, females lose substantially volume, whereas males don't. One of the explanations for this is the effects of sarcopenia. And the effects of sarcopenia can be compared to the effects of osteoporosis on bones. So osteoporosis on bones results in reduced bone density and bone mass, as opposed to, and very similar to, sarcopenia, which also results in loss of muscle mass. So like osteoporosis affects bones, this is how sarcopenia affects muscles. And in the face, we do have these features, especially in the temple. And now when we look at bones, it's important to note that overall, a female skull is smaller than a male skull, and a female skull, however, also increases the changes as we age. You can see the differences between male and females. Both of them kind of like change statistically significant as we age, and especially females do this for the volume of the calvaria. You can see here the statistical significance is predominantly seen in females, but not in males. And this also affects the form of the midface when you look at midfacial height, and also when you look at the mandible. You can see here, the mandible is significantly different between males and females. And as we age, especially the lower face needs a lot of attention, because when we lose muscle mass, which is reflected by masseter muscle, which is also affected by sarcopenia, but also of the bones with the alveolar processes, all of them influence the aesthetic appearance, especially on the lower face. That means, especially also males, they need attention to the lower face. And if we understand these respective areas, and if we understand all of these components, we kind of like understand how we need to see the difference of aging on all of the features that we have in the face, but also on sex dimorphism, because males are different than females. And it starts with the bone, and it starts also with the overlying soft tissues. And now we're coming to an end of my presentation, and I would like to stop sharing my screen, and I would like to thank you very much for your attention. And now that we have set the underlying foundation of understanding that there is a difference between male and female, which is reflected in the soft tissues, in the muscles, and in the bone. If we understand that these components, they're all differences between males and females, if we understand this entire component, we also understand how we can address the treatments. And the treatments are, of course, focusing on the midface and the low face, because there especially we have differences between males and females, because males have a square-like facial appearance, they have a strong jaw, a wide chin, the lip proportions are different. This is very different in males as opposed to in females. And Nazaret, she will talk about the respective treatment when it comes to the low face and focusing specifically on the lower face. And after that, we're going to look at the other face with Miguel when he's going to talk about the gluteal region. But first, Nazaret, I'm very happy that you joined this webinar, and I'm very happy that you share your experience with the audience. And now, please, the stage is yours, and share your presentation, please.
Hello, everyone. Hello from Spain. First of all, sorry, because my English, I know it's not very good, but I hope everybody can understand me. I will make my best to be understandable for everybody. So now I will start with my presentation about the face in men, how can masculinizate the face and how to treat everything in men. So I think we need some seconds to start the presentation. Here, this is me. I'm plastic surgeon in Spain. I work like a plastic and reconstructive surgeon, and I'm a specialist in facial and body aesthetic surgery and non-surgery procedures for aesthetic. And today I'm going to talk about facial contouring because it's a trending topic in men and in women, because it improves the face, but not only the face, it improves the neck too. So with non-invasive technique, we can improve the appearance of our face. And also in men, we can achieve a more masculine aspect. Like you can see in the photographs, the most handsome men in the world have a very good definition in the mandibular area. So our patients, our male patients, wants to have this appearance. we can see in the last years, in the last 20 years, that there has been a very high of number of men that go up to our office to look for facial procedures, surgical and non-surgical procedures. And one on the highest increasement of this procedure is the jawline filler to improve the contour of the face. So that's why we are going to talk about this. Our patients, our male patients, are going to be between their 30s and their 50s, and they are looking for a good definition mandible, a good definition in the cheek, and of course, a good definition between the face and the neck with a good defined angle in this part. And like Dr. Cotofana said, there's a different appearance between men and women. And this difference is because in men, to get a good masculinization, we must have a wide and high forehead. The brow must be low. The foxy eye is not for men, it's for women. Of course, we can have men that loves a foxy eye, but there is not a masculine aspect. We will have a straight nose, a square jaw, a projected chin, and a very projected supraorbital ring. And how can we get this? We will talk about fillers, and bioscience have fillers called Genefill that we can use to get a masculine aspect in men and to make a good profile in women. With Genefill, we have a filler only for hydratation, a filler for little parts of the skin. We have another filler that feels more for a deep wrinkles. And for me, the best of the product that is Genefill DX, that is the product that we'll use for contouring of the face and improve face and neck in men and in women. These different products will be used in different parts of the skin. We will use Genefill Fine in the superficial part of the dermis. We will use Genefill Soft Fill and Soft Touch in the middle part of the dermis and the deep part, but we will use Genefill DX in the deepest part of the skin and the supraperiosteal area. We will use them to improve the profile and to put in the deepest wrinkles of the face. So we will use it in the cheeks, we will use it in the most deepest part of the nasolabial folds or the marionette lines, and of course in the jawline and in the chin. But what is Genefill DX? Genefill DX is a special filler because it's hybrid. It's mixed of a cross-linked hyaluronic acid, biphasic, and dextranomer, that it's a glucan. And this mix make an 1 milliliter syringe with a liquid that is white because of this glucan, and that will make a filler of the face for more than 12 months. And it feels, but it produces a stimulate of collagen and elastin because of the presence of the dextranomer. The dextranomer is this, that is a glucan that make a scaffold where the hyaluronic is going to go inside the holes. So it will produce not only a filler, but a regeneration of the dermis. No tyndall effect because it's white, a very long-lasting effect because this dextranomer will protect the hyaluronic from the hyaluronidase of the body. So it will be a long-lasting effect in our face. And of course, like I told you before, we will use it very, very deep in the deepest part of the dermis or in the supraperiosteal area. So in the contour, in the place we are going to put in women to improve face and neck, and in men to make a masculinization, we will use in the bone to improve these parts. Like Dr. Cotofana told before, with age, we are going to lose the height of the mandibular area and of course of the cheek. And this will make a loss of definition of the mandibular and of course the appearance of the tear through. So if we put a filler, a special filler like Genefill DX in this part, we are going to improve the appearance, and of course in men, make a more masculine aspect. Here you can see again how is the aging of the skin and how we lose the definition of the jawline with the pass of the years. And here, how can we treat this with Genefill DX? When we use the Genefill DX in the cheek or in the mandibular area, we can achieve a more masculine aspect and of course a good definition between the face and the neck. And now the most important thing is to show you how I do this technique in my patients. So here I'm going to use a video. If it starts, here it is, where I will show you my patient. This is my patient. He is 45 years old, and I'm going to use Genefill DX. First of all, I will mark the patient. How can I mark it? I mark the chin, of course, the medial part, because we want the same filler in one side and the other. We will mark how is the height of the mandibular area. We will mark the anterior part of the jaw, because we are not going to inject in the jaw, because we will make worse the problem of the bad definition of the jawline. And after these markings, and the angle, of course, I will mark it, I will put anesthesia. Here you can see how I mark the medial part of the face. How can I see the medial malar fat pad that with aging we will have this malar area descent, and of course it will be with less fat. And I will put a bit of anesthesia in the points of entrance. I will use needle or cannula, depends on the part of the filler. First of all, I treat the chin with normally only one puncture here in the middle, but we can use, if we want to put more volume, two in the lateral parts. I will make a very, very deep injection in the medial part, in the supraperiosteal, and in lateral I can do very deep, not supraperiosteal, but in the deepest part of the dermis. Be careful, because here we have two nerves that we need to know. After this, I will go to the prejaw area, where I will leave 3 little points of filler in the periosteum. Of course, I will use needle. Here you can see a 25 gauge needle that I use normally. After this, I will go to the angle. I usually make one side and the other side after, and not one side and the other, because I want symmetry, and for me it's very important. So I used to do one first and the other. In the angle, I will use the needle in the supraperiosteal area, but when I go to the other part of the mandible, I will use a cannula, a 25 gauge cannula, because I'm going to go not in the periosteum, because we can find there some anatomical structure that we can damage, and we will go in the deepest part of the dermis that you can see now in the video. How much of product that will be used? It depends on the patient. I cannot say, okay, you must put exactly this amount of filler. It depends. After, I can tell you exactly what's the amount of filler I use, but it depends on each patient. In this patient, you can see it has a retrognathia, has the chin very, very posterior. So I needed a lot of filler here, more than in other men that have a good fill there. In this man, I use here too, in the mental area, to improve this wrinkle and to make this part, the part of the chin, longer, to improve the masculinity of the face. And after the inferior part, I go to the middle part of the face. First of all, I used to feel the medial malar fat pad, and I use always a cannula, never a cannula thinner than 25 gauge, because there is the risk of cannulate the vessels. So I prefer that it's not very thin cannula there. And after that, with needle, I will go to the periosteum in the malar area and the zygomatic area. In men, it's strange that I use the lateral part of the malar area, the zygomatic area, because it will feminize the aspect. So in men, we will try to put more here in the medial malar fat pad and in the periosteum of the malar area. And what's the result? We look for natural result. In this boy, you can see how can we get a square mandible and a good projection of the chin. Okay, I will show you. I need help. I cannot put the last slide. Here we are. This is the result. So you can see in the lateral view that we don't have jawline. We have an advancement of the chin. We have this chin longer. We improved the tear through. And of course, we have a square mandible. So we get a good result. In this case, we use it 4.5 vials of Genefill DX, 2.5 here, and the rest in the medial part and in the piriform area. And I think that's all. Thank you very much for your attention. And of course, if you have any question, please ask it in question and answers, because after we will have time to solve everything.
Nazaret, thank you very much for showcasing your injection techniques and how you assess the patient. I think this is one of the most important features, which is patient assessment. So that means that we look at the patient, we identify, well, the patient has a weak chin or a weak jawline, and then you address this, and the outcome is increased masculinity. I think these are very important features to consider. And I think you did a fantastic job with this one. And however, without further ado, because we're going to have question and answer session at the end, because normally I would have a lot of questions for you, but we're going to put that at the end, because I can also already see here that Miguel is with us, and Miguel is getting ready now for his presentation, for looking at how he assesses the gluteal region and how it then treats using the respective portfolio. Miguel, thank you very much for joining us, even though for you it's fairly late in the evening, and we're all, and I especially, look very forward to your presentation.
Thank you, Professor Cotofana, for the warm introduction. Thank you, Bioscience, for organizing this nice webinar. And I think these type of events are really, really important, and they came after the COVID, right? And they are here to stay, definitely. And I think it's a very, very powerful tool, very powerful educational tool. So, and there are a lot of participants. Welcome all to the presentation. Thank you for being here from all around the world, right? So we are going to talk, and I always like how Professor Cotofana names it, like the other face. No, the other face is the buttock in our patients. So we are going to talk about the buttock reshaping and buttock masculinization and transforming these male aesthetics for our patients. Now, male patients is not longer something unusual that we see on our clinic. It's part of the type of patients that come on a daily basis to see us. So we need to be ready and prepared to give them the best treatment as possible, just as we do with women, right? I like to talk not so much about augmentation. Sometimes we need to understand what our patients want, and in most of the cases, they don't really like an augmentation. It's more like a reshape and a better contour of the area, okay? The first thing that we need to understand in our cases is, as the great presentation that Professor Cotofana made before about the anatomical differences and the dimorphism of male and female, the differences that we have. And one of the ways that we can look at it is looking to the artistic point of view. So you have this very nice atlas, this very nice book called Seen from Behind, and it's focusing on perspective of art and the male body and the Renaissance. So this is a very nice recommendation if you want to take a look. We need to understand the anatomy. I'm going to pass through very fast about the classic and essential anatomy, but it's not only important to talk about the classic anatomy that we see on the books and that we learn on med school. It's important to talk about the art anatomy and the artistic point of view, as we are going to see. A lot of practitioners are usually worried about the vascular supply of the area, and they're worried about causing an embolization of the product in the area. But I want you to understand that and keep in mind that the vessels here are very, very deep into the muscle. So one thing is a fat embolism using fat when the patient is fully asleep. And other thing is causing an embolization with the hyaluronic acid, which is very, 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 I mean, you really need to go very deep into the muscle to get into one of these vessels. So, and the patient would jump out of the clinic if you do that. So it's highly unlikely to embolize one of these big vessels. And the same happens with the sciatic nerve. It goes really, really deep, and it's highly unlikely that you get to it, even if you try to. So don't worry about this issue. As I said, the anatomy has to be seen not as a static thing, as something that we learn from the books, but also as a dynamic thing, especially not only in the buttock, but also in the face, in different areas. We need to understand how the muscles contract and give different shapes and appearances. So you have to take a look to different videos. This is only for scientific purposes. Just take a look to these videos and see how the shape in these top models. So they have perfect bodies, let's say, but you can see how the hip dip is present in these cases, because it's part of it's part of normal anatomy with not too much of a subcutaneous tissue and thick muscle. You can get that type of shape. So from an artistic point of view, you need to understand not only the classic anatomy, the dynamic anatomy, but also the artistic point of view. The buttock shape is going to be mainly created by 3 bubbles composed by 3 different muscles: the gluteus medius, the gluteus maximus, and the tensor fasciae lata. That is going to provide the shape of the buttock and the hip dip in the lateral aspect. Okay. You can divide the shape of the buttocks classically in these 4 different types of shape: the A shape, V shape, round, or square. But as we know, there are many, many more different types of shapes, right? So it's not that easy to just differentiate these 4 different types of shape. But what happens with the masculine buttocks? Because we've been talking all these about female buttocks, but there's not so much discussed or published about male buttocks until recently, until there's been some papers talking about this. And this is one of our papers discussing how can we change the shape from a male patient to a female shape in the buttock in gender affirmation patients. Okay, this is really, really important for these type of patients, and transforming this type of masculine shape into a more feminine shape, it's highly relevant for them and for their satisfaction. Regarding the male aesthetics, there are also other papers published that I'm going to share with you, like this one from Alfredo, just very nice, talking about the different areas, different zones for masculinizing the shape of the buttock, which is very different to giving a shape of a female, obviously. And this recent paper talking about a definition of the ideal male buttocks, because a lot have been published about the female ideal buttock with a smaller waist to hip ratio, with wide hips and narrow waist. And that's the main characteristic in female buttock reshaping, to provide a narrow waist and a bigger, wider hips. But in male patients, it was not so clear. One of the most important aspects is, as discussed in this paper, is the lateral thigh to buttock ratio, which essentially it's what we define as projection. Okay, so the first row that we see here, it's essentially the most important aspect as resulted from this survey population. Okay, and it's pretty constant in different surveys and different panels. So it's not only females evaluating how a male looks, it's also male panelists surveying how that shape looks, and they all decide that that type of projection is one of the main characteristics defining masculine ideal buttock. Okay, so in these 3D scans, you can see how different it is. And as Professor Cotofana mentioned, there are mainly three structures that define the different shape. It's the muscle, it's the bone, and it's the fat. So in the fat distribution, obviously, is very different. In the muscle distribution, it's really different because the bone structure is different. So the pelvic bone is one of the structures with a higher dimorphism between and change between male and female. In the female body is wider, and the male body is narrower. So that also affects how the muscles are attached to that bone, right? So in the male body, the muscle is going to start quite high here, okay, from the gluteus medius, and very lengthily is going to be occupying all this space in that buttock shape, okay? In the female, is going to be lower. So that's very important as well when we are doing the planification of the filler injection, okay? And this also explains why female patients, even if they do 1,000 squats every day, they will still not have that wide hips, because there's simply not muscle in this region, these only attachments. So when they do a lot of squats, yes, they can get a very decent, very nice projection, but they cannot get that type of wide hips. That's what they usually want. So this is the fat distribution. Also, we have to keep this in mind. The female buttock, there's a lot more of fat pads compared with the male buttock. This is really, really important, and this is going to tell us how to proceed. So what tools do we have? Now we know the artistic point of view and the differences between a female and a male body, obviously, and the male shape and the buttock, and what's the ideal. But what are the tools that we have available? We have implants, either solid or gel implants. We have liposuction and liposculpture. But I have to say, in this type of patients, most of the male patients that come to the clinic are very fit, and they usually don't have too much fat, and they are willing to get that type of projection. Nothing too dramatic, but something a little bit. So it's difficult to find enough fat in these cases to provide the results that they want. That's why in most of them, we end up using or proposing to use the hyaluronic acid, the fillers. In this case, Genefill Contour is the one that I commonly use. And it's at the end, the product, the characteristics of the product that we are using in the body obviously has to be different than the one that we use for the face, right? It's the same as the soap. We are not using the same soap to clean your face, that's the same that you clean your buttock, right? So the filler that we are using for the buttock, it's different than the filler that we are using for the face. This is really, really important to keep in mind, okay? And obviously, it's not only the filler, it's also having a proper injection technique to avoid fast reabsorption, to place the filler in the proper plane and avoid side effects, okay? The filler that we are going to use for the body is larger particles between 300 and 500 microns. So the smaller particles expose more surface and they have less volume. So they have a faster reabsorption, while the large particles that we are using for the body are much more stable against this enzymatic degradation. So at the end, this product is going to last longer. This is also something important to mention to our patients, because sometimes the patients are worried because they feel that they will need to have multiple touch-ups with time, and they are going to pay. I mean, the cost of this type of services is quite high, because we are going to use a lot of product, and the patients sometimes they feel that, okay, if I am going to be needing to be doing this every 6 months, I don't want to do it. And what I always tell them is that the changes that we are achieving with the product and the changes that it gives into the shape of the buttock is when the product dissolves after, as it's published and showed, 18 months of duration, it's not going back to square one. It's not going to come back to the stage 0 pre procedure. Okay, so it's still going to have a different shape and a nice result because of the collagen induction, the water retention in the area. So this is something really important to keep in mind. There are 2 products in the portfolio for the body in Genefill. Okay, we have Genefill Contour. Okay, it comes in a 10 ml syringe, the duration 18 months, biphasic filler, high particle size. And what I want to transmit you is that Genefill Contour is like soft. You know, it's like giving volume, but not like bulk volume. Okay, and we have also Genefill Contour Plus. So Genefill Contour Plus, the same. It comes 10 ml syringe, same duration, biphasic filler as well. But this one is really going to give us bulk. Okay, you are really going to notice volume. So that's why it's mainly used, or the main recommendation is to be used for the gluteal region. Okay, I like to use both. I like to use the Contour Plus to give more bulk, and the Contour to soften a little bit the edges, or to provide a little bit of more soft touch to certain areas. Okay. Yeah, this is the definition more or less. These are the indications and the recommendations from the company about the volume that we can use per session. Okay, so in my point of view, I prefer to be conservative and put not too much volume on one session. And if the patient wants to redo and to have another session, they can have it after usually like around 1 month, something like that. If they want to have more volume, okay? Also for hands and calf. What's going on? It's okay. Here we are. Yeah. The patient, it's very important, patient selection. First of all, what I always recommend to everyone is to be on the same page with the patient. So if we gave the keys for masculinization, but there are some patients that they might want hip dips. I have that patients, sometimes they want to have wider hips, even if they are male. But they need to understand, they need to know that it's going to give a more feminine look. Okay, but if they understand that, and that's what they are willing to that's totally fine, okay? The important thing is that the patient needs to have a firm skin, and so they can have a good tissue coverage and good thickness of the subdermal layer, okay? That's important. Otherwise, the patient might notice some bumps, and that's why they need to have that type of good quality of skin. For the anesthesia, I like to put the anesthesia on the points of entry as Nazaret showed, and also add 10 cc of anesthesia in the area where we are going to place the filler, okay? I don't like to add more anesthesia in that area because it can change the volumes and it can confuse us a little bit while we are injecting, okay? So as a model, we are going to use the Prometheus that killed Medusa here. We are going to mark the area that is going to be treated, especially with the patient in standing position. It's important to take pictures because the patients, we all have asymmetries, right? And usually female patients are very aware of their breast asymmetries, you know, but usually nobody's taking a look every day to our buttocks. So most of the patients, they are not aware of their slight asymmetries that they present because one hip is slightly higher than the other. And you have to show it to them because after the procedure, they're going to start taking pictures as crazy, right? They are going to love the result. They're going to start taking pictures from behind, and they are going to start noticing those asymmetries that they were having before, and they can blame you. So make sure that they understand before the procedure their asymmetries and their anatomy, okay? Detect the areas to be augmented and clean the area to be treated with antiseptic solution, okay? I like to use a 3-point injection technique. So in some cases, you probably have seen just 1 point of entry. I think that is not going to give us a proper entry or proper access for the filler injection. And I think a 3-point injection is really not going to change too much for the patient because it's just a tiny incision or injection, tiny puncture. So I start with this one from the lateral aspect of the gluteus maximus, okay? If you find it difficult to locate this point, you can ask the patient to contract, okay? And you can notice the lateral aspect of the gluteus maximus, okay? In that entry point, I'm going to put 10 cc of Contour Plus, okay? Genefill Contour Plus, 10 cc syringe. That is going to give us bulk. That is going to give us more volume in the point of maximum projection, okay? Then I'm going to go to the upper part. The upper point of entry, the superior point of entry, you can palpate in the iliac crest, okay, and go towards the midline, and that's usually the point of insertion of the gluteus maximus. In that area, do that point of entry and go to the lower aspect, okay? In that point, I usually infiltrate 10 cc of Contour, okay? Because it's going to soften us that upper part, okay? To create a more soft transition. And then from the inferior aspect of the buttock, just like 2 centimeters above the infragluteal crease, another point of entry, as I said, 2 centimeters above the gluteal crease, because if you go through the gluteal crease, there's a higher risk that you go directly to the muscle. And then the patient is going to jump from the clinic, is going to run away. We don't want that. So just 2 centimeters above the infragluteal crease, that is going to give us a safer point of entry and provide another like 10 cc's of Contour in that lower part, okay? It's very important that you do this in both sides, as Nazaret mentioned before. Don't do one buttock and then start doing the other one. Because if you do so, when by the end of the second buttock, the first one is going to be swollen and you are going to think, oh my God, I need to put more filler in this second one. And you are going to get confused. So start with one point of entry on the right side, one point of entry in the left buttock, another point of entry in the right side, another point of entry in the left side, and then again and again, okay? If the patient wants more volume, or I expect that they need more volume, I redo following the same steps. So again, from the central part, upper part, and lower part, okay? And you can get, especially in the 3/4 point of view, higher projection in the upper part of the buttock. That's the main thing in these type of patients that they want to get. Post-treatment recommendations. Pain can be controlled with use of painkillers, just whatever they have at home. I tell them to get something when they get home, and that's usually fine. Avoid heavy exercise for 1 week until the product is settled, more or less. Avoid sitting down for at least 24 hours. I prefer them to lay on the belly, or even to lay on their back on the bed. But that's better. I prefer that than sitting down. Sitting down is what really messes things up, because it's going to push into the bone, and there can be some displacement of the filler. Okay, so avoid sitting down for at least those first 24 hours. Cold can help with the swelling for the first couple of days, or with some pain. And get some pictures for the follow-up. Okay, they are going to start taking pictures as crazy, so they can send you some as well. Okay, thank you so much. I think it didn't took so long as in the Incas. I didn't get delayed so much. So thank you so much. You are always welcome to visit us here in Cleveland Clinic, Abu Dhabi. And this is my Instagram and my email. If you have any questions, concerns, whatever, feel free to reach me.
Miguel, thank you very much. That was a very, very nice presentation. I highly appreciate it. And I very much liked how you emphasized towards the end, first the center, then the top, and then from below. I think that's a very good point, because sometimes I do see that, when you start to treat one gluteal area and you want to go to the other one, then you might apply more volume because the other one is already swollen.
Yes,
that's a very good point. But Miguel, one of the questions that I have for you is we know that sometimes for gluteal augmentation procedures, there are some severe adverse events associated with the fact that when we inject too deep, and the current theory from what you read in the literature is when you go too deep, you go into the muscles and then you affect the veins, and from the veins it goes to the lungs. Now, my question to you is how do you assure safety during your procedures?
Yes, so that's very good, important point. So the fat embolism cases has been described during BBLs, the Brazilian butt lift, which is essentially liposculpture and fat transfer to the buttocks. The point is that those procedures are done under general anesthesia, and there's a risk of getting inside the muscle, especially if by surgeons that are not properly trained, and all different things. But they can get into the muscle and transfer the fat into the veins. The thing is that when you are doing the procedure with the hyaluronic acid, the patient, it's very rare that you're going to do it with a patient under general anesthesia. Maybe I've done it once because the patient was really, really scared and she wanted to have a very deep sedation, but usually it's not the case. And if you go very deep into the muscle, the patient is going to jump. Even with the anesthesia, and that you put anesthesia, the patient is going to contract, is going to move, it's going to be painful. So that's one thing. That's why I think it's highly unlikely to get into those vessels, because they're quite deep. And of course, knowing anatomy. So with Professor Cotofana, it's really, really important to follow his courses and his anatomy lessons, because that's very, very important, and try to stay away of the area where the vessels are. Although, as I said, it's highly unlikely that with a procedure on the clinic, with the patient awake, you get so deep into the muscle without the patient like really noticing it. And last but not least, if you can have access to an ultrasound that and you, I mean, that can give you an extra confidence, an extra safety, at least for the first cases, until you gain that confidence. That can also be helpful. Those would be my tips.
Mm-hmm. I think that's a very good point, kind of like knowing the anatomy, that you need to stay superficial, and sometimes using an ultrasound. I think these are all great points for the audience to take away. And at the same time, now, Nazareth, my question to you: when you inject the face, how do you assure safety during your treatment? I think that's also an important aspect that we need to consider, because safety is always a crucial thing that we need to respect.
Yes, the best is always the prevention. So you need to know good anatomy of the face, to know where are the vessels, where can you have problems. And of course, if you are injecting with needle, you always must to aspirate to know if you are in a vessel, if you know that near can be vessels important. And in the middle part of the medial face, where you can find the vessels that can make more problems for you and for everyone, I always use cannula, and not very thin cannula to prevent the cannulation of the arteries of the veins there. This is the first thing you have to do, but I think the best is always to know in anatomy.
Well, I'm very glad that you mentioned this, knowing anatomy, because I also think it's important to do this, and also using a cannula and performing pre-injection aspiration if some cases allow, and especially when you're using needles. I think these are all great safety concerns. But now, Nazareth, and then Miguel, I'm getting back to you. Nazareth, how much volume do you normally use for a full face treatment? Just approximately, how much volume do you normally use?
I never use more than 10 vials. I think 10 is my limit. And I always use between 3 and 6. Usually in the medial part, I use 3 points of entrance, and I usually 0.5 in its side. So I will use 1 vial and 2 in the inferior part. In some patients, I will need more. So I think between 3 and 6, and never more than 10.
Never more than 10, okay. And Nazareth, and after you treat the patients, when do you expect to see the full aesthetic effect after your treatment?
I usually see my patients that the result, not definitely, but nearly the definitely effect will be 2 weeks after the procedure, because this filler will cut more volume with days. So at the first, we will have some volume in the post-immediate treatment. At the 3-4 days, nearly a week, we will have some swelling. And after 2 weeks, we will have more or less the definitely effect of our filler. I always say I prefer to put less than more, because if we put less volume, we can have more 2 weeks after. But if we put more than will be necessary, it's very difficult to put less.
Understand. These are great components. Miguel, same question for you. How much volume do you normally put per site, and then in total? And also, when do you expect to see the final aesthetic outcome? Do you do touch-ups, or do you don't do touch-ups?
Yeah. So usually I use those 3 syringes per side. Okay, 1 contour plus and 2 contour per side. Okay. And in some cases, usually in male patients, we need less than in female patients, because in female patients, we want a more dramatic hip expansion. So in male patients, it's more for that projection in the upper part. So usually with those 3 syringes per side, usually is enough. In some cases with extreme, like very flat buttock, we might need to add another round. So 6 per side, but on the same day, okay? On the same day, 6 per side. And then the patients usually are very, you know, they have that type of flush effect, the absorption of water the first couple of days, and most of them, they are very happy with that edema and some swelling. But then when it goes down, you have to show them like the before and after pictures to make them see the difference. And if they want to have slightly more volume, then we can do that touch up. I generally, in the buttock, I generally wait from 2 to 4 weeks for a touch up until everything is more or less more settled.
So, so you always said syringes, but how much is this in milliliters? So to understand.
So it's 30 milliliters per side, total 60 milliliters in most of the cases. In certain cases where it's very flat, I would do 60 milliliters per side.
Okay, is there a maximum volume? Like for instance, Nazaret says she doesn't go more than 10. Is there a maximum volume for you as well?
Yeah, I generally don't like to do more than 15 syringes, so 150 mLs in one session.
Okay, no more than 150. Okay.
Yeah.
Well,
yeah.
Thank you for answering those questions. Now I will look into the chat box, and I see here a question from Carlos. And Carlos is asking, is this product Flogluteal region also approved in the United States? Well, the answer is no, it is not approved yet in the United States. However, it's approved in the European Union, in a couple of countries in Latin America, and also in a couple of countries in the Middle East. But for detailed information, you need to visit the Bioscience webpage or social media, or contact someone from the company, because they will provide you with the respective information. And now when I look at the time, I can already see we're almost at the end of the session. Look at this. We have 2 minutes left. In those last 2 minutes, I would like, of course, to thank Nazareth. Thank you very much for joining this webinar. I always enjoy your presentations. And of course, Miguel, thank you so much also for being with us here, especially for you, for it's late. It's 8:30 for you, right?
Yes.
Yeah, in Abu Dhabi, but it's a beautiful location. I saw it on your picture and your presentation, like, oh, amazing.
Yeah.
You know, if
you
I would turn
come,
the camera,
you should come. Yeah, you want to come, and we can. Yeah, you should visit. Yeah.
Oh, I would love to, honestly. The funny thing is, you know, if I would turn my camera now to the side, you would see that everything is full of snow. Like, because
really?
here it's just, yeah, it's just how it is. So again, I would like to thank the audience for joining us for this webinar. And again, as a last word, I always would like to mention is males also have needs. Aesthetics is not only about females, it's also about males, and it's important to understand what male aesthetics look like in terms of assessment. It also need to understand that you need to choose the right products, and you also need to be able to predict the aesthetic outcome to increase masculinity if this is the desired outcome. And I do think the injection technique that we've seen today and the portfolio presented allow for great outcomes, and of course for safer outcome if the safety considerations are applied, like Nazareth and Miguel said. And with this, we're coming to an end. Again, I would like to thank you very much, both of you, and I would like to thank Bioscience for organizing this webinar, and I would like to thank everyone who joined us, and I'm looking forward to seeing you next time. Thank you so much. Bye-bye.